And on This Week in Pharmacy, I'm proud to have Marie and Anais back. If you remember, Would You Like Shots with That has been transformed to HARMACY, pharmacy without the P, HARMACY. And I think it's much more powerful because of the harm that has come from the run amok ways of how prescriptions are being processed and paid for in the PBMs. But there's relativity to this and context to this because of the ESI protest, the Express Scripts protest. Marie, you were there, so I just want to open up to you and kick this off to you. It's exciting to have you back.
Thank you for having us. It's been an exciting ride. I flew into St. Louis Thursday before, and when I got on site to the Express Scripts headquarters, it was really exciting to see how the patient story has started to converge with the pharmacist story, and it's really creating a narrative that is going to drive the mission forward for not just PBM reform, but patient access. Pharmacists are able to elevate their role in the healthcare system and practice at the top of their license. So it was a really meaningful, emotional time. We've had HUT was there, NCPA was there with CEO Doug Hoey, APHA, and then Missouri Pharmacists Association. There were some students, there were people who were eager to participate, but they were nervous about retaliation that we know is real. And so they opted to not be on camera. But we had an excellent crew that we found on site in St. Louis, Solstice Productions. And all in all, I think it was very successful. And it's going to add a lot of context to our narrative as we continue working on the documentary.
And I just wanted to also shout out NCPA Pharmacy, as you can see on the screen, because they're the ones who made it possible for us to go. They sponsored our travel, and so it was with their contribution that we were able to go out there. So we wanted to say thank you, NCPA, for your support of this project and of pharmacy.
Thank you to NCPA. A shout out to Pharmacists United for Truth and Transparency as well. Also a special guest that was there that helped to organize.
Yes.
Loretta. Please, Marie, tell us a little bit about Loretta. Loretta is going to be on our PBM Reform podcast coming up, but tell us a little bit about Loretta's efforts too.
Yeah, so I met Loretta through when I joined the HARMACY team, and her backstory is pretty emotional. I won't get into it in detail, but basically in her experience, she's had, an impacted, sorry, let me start this over. Mail order pharmacy had a direct impact on her son's health and her son's life. And as a result of that, she realized that nobody was advocating, and she took it upon herself. And she started by just telling her story. And when we connected in St. Louis, we sat alone after the protest, and she's shared how much her advocacy work has progressed over the years, where she's got thousands of people reaching out to her that are experiencing the issues with mail order pharmacy access, clinical issues with medication. I'm not a clinician, I can't speak to that, but I think it's a testament to the change that can happen because one person decides that they need to do something about it and they work to make a difference. So,
what films that you have seen over your lifetime do you think helped the public? And usually this is a documentary type, obviously, that has factual information and interviews, that has helped to move a needle or help Congress to get involved or help the public to become protected based on a documentary team like you, who is, and I know it's needed, right? The layperson doesn't realize how intricate and how complex PBM reform is, nor do they understand how a PBM is disrupting the ecosystem of healthcare and it's killing people. So, and it is Harmacy. So what films have you seen in the past that you're like, wow, that finally really helped us to get the public outraged? Because that almost seems like it's the last, I don't want to say the last stage, but it's such an important stage for us to see meaningful change in insurance for prescription coverage.
I'll let you start.
No, I want to start to you. Go ahead, Anais.
That's hard off the cuff, but I will start with the bleeding edge, which comes to mind, which is about the medical device industry and getting people aware of how that industry has some issues with regulations. And in that film, they were able to get some of the devices off of the market that were harming people. So there was a direct impact on patients. So that is one that I think of that comes to mind. There's also films that start conversations and get a conversation going so that other films can start. So for example, if you take the Pharmacist documentary with Dan Schneider, I know that film influenced the creator of Dopesick to have that piece take off. And with Dopesick, that spurred a conversation when it came to things that are happening with the opioid crisis. And it is more well known in the general audience sense than the Pharmacist was, but the Pharmacist kind of was a springboard so that other films could take place. So we don't want to be the end of the conversation. We want to be the start of the conversation. Maybe we're the first, not the first, but one of the first, basically the first documentary of its kind, and other films can come after us, other projects can come after us and continue this conversation. Maybe even things like dramatizations, like with Dopesick, it became a dramatization of the problem and not necessarily a documentary, and those speak to people in a different way and reach a broader audience.
Yeah. And I think the one that stood out to me when you asked the question was the documentary Blackfish, where it was about SeaWorld and killer whales living in captivity. And you know, that's one that stood out to me that I never realized the backstory in that. And it did, you know, they released these animals when and where they could, but I think it just brought a level of awareness to the population that didn't exist before.
On the website harmacyfilm.com, that's Harmacy, pharmacy with just the H without the P, harmacyfilm.com. You're also collecting additional stories from people in the industry, people that have been impacted by you know, the insurance situation. Talk to that a little bit. Who else are you looking to involve in the documentary?
Oh, go ahead.
You go.
So we're really eager to get more patient stories. There are a couple of, you know, we have a handful of really strong ones. But I think, as I stated earlier, you know, the real power of the story is going to come when the patient kind of aligns with the pharmacist story and it drives forward because they impact each other. So I think the easy answer is we need patient stories, and the more complex answer that I'll throw over to Anais is we want to capture the other side of the story, and so that means pharmacy benefactors, corporations, etc.
Yep, we would like to open our doors. We say this on every podcast we've gone on the entire time we've been going on podcasts speaking to the story is we want it to be an open door. We want it to be an open conversation where we invite people from the PBM. So we want leadership from Express Scripts, CVS Caremark, from Optum. We want leadership from Walgreens, from CVS, from Rite Aid, from Walmart to come to the table because we want to hear their side of the story in a genuine way. We want them to be able to speak to what they are contributing in pharmacy. They have a side, they have a take, and there's no reason for us to shy away from it, especially because we have the platform and the time to get that side of the story out. And we think it would be very valuable to hear their side of the story so that we can include it in the film version as well as in our companion book version the HARMACY docubook, which has time to get into some of the nuances and get into some more details. But in order to have those details, we have to be able to have those conversations. So if anyone has connections to those folks, please send them either to the form or our way. And we welcome them with open arms.
Thank you for that. Once again, harmacyfilm.com. If you haven't heard about it, please look it up. We're going to have it in our show notes. We're going to share it on social media throughout the week from This Week in Pharmacy. What I know things are probably still baking, but what's the estimation of where do you think this could actually be finished and come out?
Still baking, but like with everything, a good quality film takes time. So that'll be my answer. And a good quality film takes time. We have the people we'd like to interview. We have our story crafted. And so once we get our full funding, we break our escrow amount, and we get deeper into the production process, then it does take to do a quality project such as this, it would take about a year to 18 months. So yes, it's looking at somewhere in later 2025. However, good things are worth the wait. And then on the book side, traditional publishing is not the fastest, and I'm just being honest. From the time we get a book deal to the time a book comes out, it takes about 2 years. And so it would be about 2 years from the time whenever that happens for us. We're right now we are pitching our book and trying to get a deal. So we're pitching to literary agents at this time. So yeah, it's a process, but if you look at films and you look at a lot of the documentaries that you love, and you actually look into their production process from development, from idea to the development process to pre-production into the actual production and post and editing, it's probably a lot longer than a lot of people realize. It's just you get to go along on the journey with us. And so that's what makes this unique and special is for those films, you see the finished products, but for us, you're along for the journey, which is why you get to see like, oh, this is actually what it takes to make something of quality.
And then the other thing I'd like to brag on is Anais was recently accepted into a documentary fellowship, which is a huge step, right? You know, we've been going around submitting applications for grants, fellowships, and when something opens, when that door like that opens up, I think I'll let her speak to it, but it reinforces that we're on the right path and we're doing the right work.
Yes, it was incredibly exciting. So the organization is Docs in Progress. Marie found it in April, and we're like, oh, wow, this is really exciting. The deadline's coming up soon. Let's do it. And we put together, I put together my packet for submission, and then I found out last week, and it was really exciting to work with filmmakers who have done this before. It's people who have produced films, and then our cohort is emerging filmmakers. It's folks who are similar to us at HARMACY, where we're getting our feet wet. We're newer to the game, but now we have the support of mentorship and folks who have done this for a long time to be able to help guide us. And it's a structured program. It's, to me, our first cohort meeting was last night, and it honestly felt like mini film school. I was like, wow, it's like mini film school. Like we're doing case studies, and we're watching clips, and we're talking through things, and they're giving us resources, and they're saying, if you have anything that you need for the project, reach out. We have resources. We want you to succeed. It's something that it's so constructive, and it's just a great community already, and it's only been like a week that we've known each other, that they want to level up this project. And so we know that's just a sign, like this project is maturing in a way that it's like we knew that it would get there. It was just a matter of time. And like Marie said, now those doors are starting to open. So TBD, there'll be updates on social media as the program progresses and announcements there about the fellowship and things that are going on with the project.
So,
And if anybody is interested in learning more about how they can support the project and help us bring it to life, I think, reach out, producer at Shots with That. And then our website obviously has a contact form. And so stories, reach out. We will, we'll reach out or, reconnect with you as soon as possible. So.
Yeah. And please follow, like, subscribe. I guess not subscribe. We don't have a podcast yet. That's coming in the down in the pipe works or whatever that saying is. We are at HARMACY Film on our social media. And so we are on the website formerly known as Twitter, aka X. We are on LinkedIn, we are on Facebook, we're on Instagram, and we are on TikTok. So whatever your social media of choice is, please meet us there.
Anais, thank you so much for this update. Marie, thank you for keeping in touch with me and reaching out and giving us an opportunity to get an update, because you're heroes of mine and I'm looking forward to seeing this film. If it's anything like the trailer, it's going to be really good. And that's another thing. If you haven't seen the trailer, please go to harmacyfilm.com. There's a trailer there that's built and it's great. So if there's any indication of what it's going to be like, so
and I'll put another plug. We're cutting a second sizzle. Let's stay tuned. It's going to be really good with the footage that we've captured over the last couple of years. So in progress right now. Stay tuned for that when we are able to release that into the world.
Thank you for having us, Todd.
Thank you for having us.
Very welcome. We'll hear more. Hope to have you both back on This Week in Pharmacy.